Hello there. Today I'm going to talk about toxoplasmosis or toxoplasmosis. Did you know more than 40 million American men, women, and children carry the coccidia parasite Toxoplasma gondii without knowing it? Yes, that's the estimate from the CDC or the Center for Disease Control based in Atlanta, Georgia. But what has toxoplasmosis got to do with coccidiosis in dogs and cats? Well, Toxoplasma gondii is a coccidia parasite too, and toxoplasmosis is a zoonotic disease. And what is a zoonotic disease? A zoonotic disease is a disease that can be transmitted between animal species, like dogs, cats, and human beings. Welcome to the corky world of coccidiosis. This is video 2 in a 3-video series that discusses diarrhea in kittens and puppies. Coccidiosis is a diarrhea disease in both puppies and kittens. The life cycle in both puppies and kittens mirror each other, right? The mode of transmission, the life cycle, the clinical size, the methods of transmission, the treatment, control, and prevention. All those mirror each other between puppies and kittens. In this video, I shall discuss coccidiosis in the cats and the role that the cat plays in the transmission of Toxoplasma gondii parasites to people like you and me. So what is coccidiosis? Coccidiosis is infestation of the cat or the kitten's intestines and other body organs by coccidia parasites. And what are coccidia parasites? Coccidia parasites are microscopic single-celled protozoan parasites that invade and live in the intestinal wall and other body organs of the cat. When a kitten is presented to me for physical examination and the cat is vomiting and having diarrhea, I straight away go ahead and do a fecal test looking for coccidiosis or hookworm eggs. If the fecal test confirms the presence of coccidiosis, my challenge now is twofold. First, I will need to explain or to educate the client about the role of the cat in the transmission of the zoonotic disease toxoplasmosis. 2, I'll need to treat the kitten for coccidiosis. There are 4 different coccidia parasites of the genus Isospora that are known to attack dogs and cats. In dogs, you have Isospora canis, Isospora ohioensis, which I suspect was first discovered in Ohio State. Then you have Isospora neorevolta and Isospora barrosi. In cats, you have Isospora feris, Isospora revolta, and Toxoplasma gondii. What's the life cycle and transmission of coccidia parasites? The coccidia life cycle is an alternating rotation between immature and mature oocysts. Immature and mature oocysts. But what is an oocyst? An oocyst is a resistant, thick-walled shell that protects a developing parasite. Stage 1 in the life cycle of coccidia. An infected cat or kitten will shed non-infective or immature parasites, oocysts, in the feces. Stage 2, the immature oocysts will mature or sporulate in the environment where the feces were shed. Stage 3, here the cats and kittens become infected when they ingest the oocyst-infected fecal matter or if they lick oocyst-contaminated objects. Stage 4, the mature or infected oocysts will then travel and lodge in the epithelial wall of the small intestines. In the small intestine, stage number 5, in the intestinal wall, the mature oocysts will go through more reproductive processes, culminating into a new generation of non-infective oocysts ready to be shed in the feces all over again. Cats are the primary or definitive hosts of coccidia parasites. You and me and other mammals are the secondary or intermediate hosts. You and me, your dog and cat, can contract Toxoplasmosis gondii from eating infected meats like beef, lamb, or pork. The three infective stages of Toxoplasmosis gondii you are likely to contract are sporozoites, tachyzoites, and bradyzoites. These parasites can lodge anywhere in the body tissues from the intestines, skeletal muscles, the brain, and the eyes. What are the clinical signs of kitten coccidiosis? The clinical signs of coccidiosis are linked to the irritation of the intestinal mucosa and destruction of the epithelium by the reproducing stages of the oocysts. Coccidiosis is a disease of kittens. Coccidiosis is a disease of kittens. Adult cats will carry coccidia parasites without showing any clinical signs. The characteristic clinical sign for coccidiosis is diarrhea, often diarrhea accompanied by blood. Then you have dehydration, lethargy, and loss of appetite. The kitten might have abdominal pain and vomiting. And how do you prevent the coccidiosis in kittens and cats? Good environmental hygiene through proper disposal of cats' fecal matter will go a long way in preventing coccidiosis. How do you treat coccidiosis in kittens and cats? Strategy number 1, stop the diarrhea and vomiting. Strategy number 2, control the hemorrhagic enteritis with steroids. Strategy number 3, correct the dehydration and replace lost electrolytes. Strategy number 4, administer herbal or sulfadimethylzine orally at a dosage of 55 mg per kilo on first day, then at 27.5 mg per kilo once a day for 3 to 5 days to cure the coccidia parasites. Are clinical signs of toxoplasmosis in people similar to those of kittens? No. While you and me may carry toxoplasma parasites without knowing it, anyone with compromised body immunity like carrying HIV virus, like people carrying HIV virus, may show some of the following signs: muscle aches and pains, headache, fever, swollen lymph nodes, especially the submandibular lymph nodes, general malaise, heart and eye problems. Women contracting the parasite just before or during pregnancy may transmit the parasite to the fetus. And while babies may be born with the parasite, they don't exhibit any clinical signs at birth until later in life when they may develop eye, brain, or heart problems. How do you prevent the toxoplasmosis in you and me? Practice good environmental hygiene by disposing cat litter safely. Wear gloves when changing and cleaning litter boxes. Avoid eating improperly cooked meats. Avoid eating improperly cooked meats. Avoid eating improperly cooked meats. Pregnant women should avoid cleaning the litter box altogether. All right? Pregnant women should avoid cleaning the litter box altogether. How is toxoplasmosis treated in people? If you suspect you are suffering from toxoplasmosis, consult your family doctor. And that's the end of the video. If this video was helpful, subscribe, share it, comment, or ask a question below. And thank you for watching, and see you in the next video.